All right, hi there, how you doing? This is
Hi.
Cara and Dr. Katina Thornton from Body Lounge Park Cities. And this week we were conducting a lot of antibody tests. We did about 200 tests. And we're just gonna talk a little bit in this video about what it is, what it means, and then what we're doing with the information. So, Dr. Thornton, first of all, why were you so motivated to bring the testing here to Park Cities?
So Stanford Health in California started this massive seroprevalence study, and they were interested in testing Santa Clara County citizens to see how far the virus had gotten into the community and maybe at what stage it had entered the community. So then they were looking for other large metropolitan areas that might be interested, and DFW just seemed like a good choice.
Got it. And so, knowing that 75205 was a big hotbed, what I thought was very interesting is that we kind of expected to see a higher incidence rate here because we were asking for people that had been either exposed, thought they had the virus, had traveled. And so what did you really get out of what we did this week?
After testing 200 patients, I think one of the most interesting things that we found was if you were sick in November and December, there's almost a 0% chance that you had COVID-19. If you were sick in January, the chances are still really, really, really low. Early February, the same, unless you had a known exposure or traveled to an area with known cases. Once we entered into late February and Mardi Gras hit and spring break in early March, then all bets were off. If you thought you had the virus, you had a good chance of testing positive. We found that New Orleans and particularly Aspen, Colorado were two areas that were really prevalent as far as bringing the virus to Dallas.
Yeah, absolutely. And I think one of the important things that came out of this, from our understanding, was that a lot of us got hit hard with some sort of flu during the time of November, even up to now. And it didn't necessarily have to be the COVID-19. There was just a lot of people that came down. It was a tough flu season in just in itself. The test that we used, where was that test from?
So that test is from South Korea, and it's Orient Gene, and it is not FDA approved.
Okay.
It was an emergency use authorization. It's not for sale. It was for testing for data. And so that was what we used that test for. Sure.
And I think what's really important to understand is that sometimes to get FDA approval they can do emergency FDA approval, which they kind of did in this case. It can take months to years to get true FDA approval. And this is such a new virus that things had to happen rapidly. So we're trying to get as much data as we can to truly understand what this thing really is. What other take-homes did you take back from this week?
So I think another good thing that we learned is that if you correlate symptom history, the PCR test, which is the diagnostic test for the virus itself, not for the antibody, along with the antibody test, you can get a pretty good picture of what each person has been exposed to. But any one of those alone is not good. So history alone is not good, PCR alone is not good, and antibody test alone is not good.
Sure, and I think that's really true to any test that we do in the clinic, right? Just because I get an MRI on somebody doesn't necessarily mean that there's symptoms associated with it. And so really understanding the clinical history I thought was important with this, not just being a data point. So we would get the history from folks that came in so we could understand what was their exposure, what were they feeling. And I think what surprised me so much was having spouses that were actually diagnosed with COVID-19, yet their spouse who they were quarantined with didn't have any antibodies. Do you want to have any thoughts around that?
Yeah, so I did give that some thought, and one possibility is that there was scrupulous hygiene and that the spouse actually didn't get exposed to the virus at all. Another possibility is the spouse got exposed to the virus, but the immune system was so strong in the spouse that it barely had to work at all to fend off a viral assault.
Mhm.
And so there may be an antibody response, but it's so low that our test cannot detect it. And then the other thing is it possible that the test was inaccurate in those patients?
Sure, yeah, and I'm going to talk about specificity and sensitivity on a different video, just because in trying to understand, like, because really there's 4 options for each of the variables that we tested for. There's either you could be positive, yet you don't have the virus, and that would be a false positive. There's a false negative, there's a true positive, and there's a false positive. So I'll talk about those things with sensitivity and specificity, which is really interesting to understand that all tests have this. There's always going to be these variables in there. And the other variable that's really there is sometimes those antibodies haven't had enough time, even though you might be positive for that result. Although most of the people that we saw had already been quarantined for numerous weeks, and we should have already seen that by the time that they got to us. So any other thoughts? Well, I'm going to give you some of my thoughts. I think, here at Body Lounge, we've been really promoting this healthy lifestyle through exercise and nutrition, and even more so with what we're seeing coming out of the studies of the people that contracted the virus and got sick or unfortunately passed. Those are really mostly immunocompromised. Not all, but it's just kind of revitalizes me to be doing what I do, which is trying to help people live a healthy lifestyle. Try to eat healthy, exercise, do the things that you can do in order to really maintain a good immune system. Because I'll guarantee that being in here and seeing patients on a day-to-day basis, I had to be exposed. You being at the hospital, you had to be exposed.
Yes.
And I would like to think that the things that we do from a physical standpoint and a breathing standpoint, these other things help fight off the virus. And other viruses, like, I don't get sick very often, and when I do, usually it's very short, and I'm hoping that that's because I'm trying to live as healthy of a lifestyle as I can, and I think that this shows us that, there is some validity to that, and some research is coming out showing, hey, just high-dose vitamin C can be effective in treating this, which a lot of times I think people think of as woo-woo, like, vitamins.
Yes.
But, when we get to the fundamentals, it's like, it's the air we breathe, it's what we eat, it's the exercise we do, it's maintaining our stress, it's making sure you're sleeping. There's so many different characteristics to staying healthy. So we hope to have more tests here soon.
Yes.
Do you want to talk at all about that?
Well, I did want to reiterate what you just said, and that is that we have to control the variables that we can. So we can't control our age. So if we're in advanced age, then we know we're in a high-risk group. There's nothing we can do about it. And we can't control our genetics. So if there is a genetic predisposition to being infected by the virus, you can't control that. But you can 100% control the things that Ed just mentioned. And that is nutrition, that is fitness, that is stress levels, and that is sleep. So I think that that's the armamentarium that we have, and so that's what we need to concentrate on.
Yeah, absolutely.
Definitely.
Well, thanks so much for joining me on this little informational video, and I'm sure we'll do a recap after the next round.
Yes.
All right.
Thank you, Ed.
Thank you.
Bye.